Hello, we're here today with Dr. Laura Bernardo, one of our staff physicians here at our Hope4Cancer Cancun Treatment Centers. Welcome, Dr. Laura.
Thank you very much. Thanks for having me here.
Surely. Tell us a little bit about your medical education and how because we go to medical school with the focus and maybe sometime in life that's a little changed. What was your journey like?
So I started med school back in 2008, and this is partially because my mom, she's a doctor. So I was in contact with medicine and helping patients my whole life. I was a very curious kid, so I used to be in her consult all the time. So I decided to study med school, and I think that's one of the best decisions I've ever taken. Only at that time it was conventional medicine. I didn't have any idea about holistic or integrative medicine, but I started med school and then had the fortune to go to Houston Medical Center for my last 2 years of med school. So that started opening the panorama for me. And after I finished med school, my first job happened to be at a nutrition clinic. So then I started discovering that everything that I knew about medicine and prescribing medication was very short. And I discovered that nutrition could help even more than just giving pills to the patients. So that started changing all my vision. And well, you just had Dr. Alan, and he happened to study with me. So when I started discovering all of these, he then referred me to you, to your practice, and that's when I started following everything that you do.
Okay. And you did other training also in medicine, right?
Yes, after finishing med school and during the time I started nutrition, I started also a master, clinical nutrition, phytotherapy, which is treatment based in plants, and psychology of nutrition.
So you mentioned that a colleague of yours told you about Hope4Cancer, and after starting out in conventional medicine, but then deviating a little bit to nutrition, which should be conventional medicine, but it isn't,
True.
right? Because the father of medicine said, "Let food be thy medicine, and medicine be thy food." But what really attracted you? What was the one thing or a couple things that attracted you to come to work at Hope4Cancer?
Well, I remember perfectly browsing through your website the first time and being in contact with the 7 key principles for the first time and realizing that there was that piece that I was missing in my practice and in practicing medicine, which is seeing the patient in all different aspects. Like I had that idea, but I didn't really know how to practice that way because there's no other place that does the same thing. So that was like adding that piece that was missing. I had like the basic medicine, nutrition. I had a little bit of psychology, but all those 7 key principles together and being done at the same time, that's what really caught my attention.
So it brought it all together for you,
Exactly.
right? What you knew, you were studying, what you were working in, and then some of the
Something
key
new.
that was new and missing. Excellent. So what have you liked now? How long have you been at Hope4Cancer?
Almost 3 years.
Almost 3 years. Okay. What have you liked the most so far about working in integrative oncology?
Well, it really is what I expected. Being able to see patients like with everything they have, which is something that does not happen in conventional medicine. In conventional medicine, you only focus in the one problem that you are treating and forgetting about everything. I'm a really curious person, and I think that it's the same way that I treat my patients. I look at every single blood work, every single test, and always try to find out underlying conditions and being able to treat all of them, having the time to be able to do that, because in the medical field you have limited time, which is something that we don't do here. And also the relationship that we have with patients is very different at outside. Even though it's very professional and formal, the contact that we have with patients is much more close.
Well, those are two such important points, right? That's not seen typically in conventional medicine is time and relationship with patients. This is so important. And so you've been here for almost 3 years, and you've seen many patients. I know that you're very meticulous because when I'm here at the Cancun Treatment Centers, we see patients together to brainstorm and to bring forth any other possibilities of treatment. If you could think of one success story or one patient that kind of stands out, who would that be? And can you tell us a little bit about that situation, please?
Well, there's many. But there's one particular patient that I remember her first follow-up. I was very impressed by the improvement. So this is a 80-year-old lady.
80 years old.
80 years old. And she first had breast cancer, got the surgery, declined chemotherapy and radiation, and that happened 20 years ago. After that, she got recurrence and unfortunately also bladder cancer. But she didn't want to have the conventional treatment. That was something that just didn't resonate with her. She came to us and started treatment, starting addressing the 7 key principles. And 3 months later, this tumor that's been growing on her body for a long period of time is shrinking significantly. And her quality of life is just so much improved. So I remember her a lot.
So we saw the cancer not only stopped from progressing, but also decreasing in size. And then very importantly is quality of life.
Yes,
right?
she had some complications because of the bladder tumor, and all of that went away in the first 3 months.
So when you were seeing this, and was this during your first few months or later?
No, a little bit later.
A little bit later. So now you knew a bit more of how things happen at Hope for Cancer,
Yes.
but it still impressed you. It still left an impact, right? Yeah. So 80 years old, and we have also younger patients. You remember anyone younger at this moment that?
Yes, we've seen several young patients, and I would think that most of them decide to take chemotherapy at the beginning. So sadly, they are very young and they have side effects of the chemotherapy. So by the time they come here, the quality of life is very poor. And after the first 3 weeks, everything is much better. And after the 3 months, even better.
Let me ask you something, Dr. Lauer. If you were to tell our audience and our viewers advice when they were first diagnosed with cancer, and they are told that they should do chemotherapy, radiation, and/or surgery, a combination of that, what would be the few things that you would tell them immediately to consider?
So my very first advice would be don't be afraid. Don't let your doctor or whoever is seeing you scare you, because they will push you and rush you into taking decisions without even having a chance to process the diagnosis itself or the course of action. So first of all, don't be afraid. Sadly, whenever someone is diagnosed with cancer, that's something that it's been going on for quite a while. So there's no reason to rush at that moment. So make an educated decision, pray, and be sure for the first step without rushing.
Okay. So don't be afraid, and then do your research and make an educated decision, and look at all the options. Possibly, if you're going to do chemotherapy and radiation, look about the holistic approach. Look at the 7 key principles and the foundations of why they have the cancer. Right?
We actually have had patients that decide to do chemotherapy, and just by the fact of having a guided nutrition, that makes all the difference with patients that would only have conventional chemotherapy without nutritional consultation and without taking care of their immune system, supplementing. And we are also able to supplement in a way that makes the chemotherapy work better with less side effects. So even if that's something that resonates with them, we are able to still treat everything holistically.
Excellent. So switching gears a little bit, we know that working in oncology, whether it's conventional world or integrative oncology, is not only stressful for the patients and the family, but for us also, it's a great responsibility, right? Because it's like, especially our patients, most of which are in stage 4, and this is their only hope. So what do you do for fun outside of work to have that balance in your life that we all need?
Well, usually I have a lot of energy, so after work I always do something related with physical activity, either going to the gym or practicing aerial silks, which is acrobatics in the air. I really like it. And extreme activities such as parachuting and those kind of stuff.
And I know you have a few cats. Is that important in your life?
Yes, that's very important. I have 6 cats, and contrary to what everybody believes, they are very loving, very caring. As soon as I get home, they are waiting for me, just like a dog would be waiting for you at home, the same way.
Good. And how important is family life for you, Dr. Laura?
It's very important. However, I actually moved down here by myself to be able to work here. So Hope4Cancer is actually the only reason I am here. So my family is far away from me, but I'm able to visit them and they visit me as well. And as I said earlier, my mom, she's a medical doctor. So I have this chance to talk to her frequently and even share things that I believe other families wouldn't understand. Since she's in the medical field and she also works with patients, she has all these good advisements for me.
Okay. And what part of Mexico are you from?
I'm actually half Mexican and half Salvadorian. And I was born in Puebla, which is close to Mexico City. But my family lives in Campeche, so it's like a puzzle, but it's very interesting.
So I know that I've never been to Puebla, but I know it's a very beautiful city.
It's a very beautiful city, but it's cold.
Okay, so
And
now you're living here in
yes.
Cancun. What do you like about living here in Cancun?
The ocean.
The ocean.
The ocean, definitely.
So you're a water person?
I'm a water person, yeah.
Okay. To wrap this up, Dr. Laura, where do you see integrative oncology or oncology going in the next 5 years?
Well, I can say already very happy that I noticed only in these 3 years compared to when I first started, we are seeing more and more patients, and we're seeing more patients that have been recently diagnosed. So they have a better chance of having a good health about in an integrative way, not only in the cancer treatment. So I definitely see integrative oncology taking care of more patients and being known, because actually there's people that does not have idea about this existing.
Okay. Thank you for that, Dr. Laura. And this is one of the reasons why we do these back and forth with our doctors, is that there's awareness, right? And you get to know our staff and our team here at Hope4Cancer Treatment Centers. And the earlier that you do your research once you're diagnosed, and actually we should all be doing our research to decrease the risk of cancer.
That's exactly what I was going to say. All the 7 key principles apply to anybody, with a diagnosis, without a diagnosis, with genetic predisposition, or even if you don't have it. This is good for all of us.
Well, thank you so much. Any last words of advice that you would like to give to our audience, Dr. Laura?
Just thank them. I'm very thankful for every single patient that's trusting their health in our hands, and that's giving us the chance to be a part of their lives and making us feel like we're part of their lives.
So we're very grateful for you. I'm very grateful for you, Dr. Laura. Thank you so much for everything that you do here for our patients at Hope4Cancer.
Thank you for the chance.
Appreciate it.